Welcome back to Family Planning and Abortion for Medical Students. Today we will be talking about family planning and methods of contraception. We will be covering the following learning objectives from APCO's Topic 33, Family Planning, including the mechanism of action, risks, benefits, and effectiveness of contraceptive methods. I will not be covering counseling for contraception directly, but have put some resources in the course folder. Generally speaking, it's important to be non-directive, non-judgmental, and supportive of the patient's choices when counseling on contraception. This is our main learning objective for today. There are several types of contraceptive options that work in different ways for varying lengths of time and each with their own benefits and risks. I will break up these methods into the following 5 categories. This will not be an all-inclusive presentation on every option within each subcategory, but I have put in the resource that I used to create this lecture if you want more information, as well as a Planned Parenthood resource you can share with patients so they can explore their options based on what fits best into their life. You'll find that in the course folder. The major categories are lifestyle, hormonal contraceptives, including emergency contraception, LARCs, barrier methods, and permanent methods. I will be discussing the first 4 categories in this video and the permanent methods in the next video. We will be discussing what these methods are, how they work, how effective they are, their advantages and disadvantages, and contraindications or other things to note. A more comprehensive document about absolute and relative contraindications for these methods from the CDC is in the course folder as well. You can also get this on your phone through an app called Contraception, which may be helpful when you're on your OBGYN clerkship on the wards. The first category is lifestyle. Lifestyle methods include abstinence, withdrawal, fertility awareness, and lactational amenorrhea. Abstinence is refraining from any sexual contact and is the only method that is 100% effective for both pregnancy and STD prevention. While it is the most effective, this is not an option for patients who desire to be sexually active. Withdrawal is a method including avoiding ejaculation inside the partner's vagina. It is about 80% effective. This method is dependent on using it correctly and consistently. Advantages include that it has no side effects, it is free, and can be an acceptable form of birth control depending on your religious preferences related to contraception. Disadvantages include no STD protection and the fact that it is not a very consistent nor particularly effective method. Fertility awareness is when the person menstruating avoids sexual intercourse around the time of ovulation based on signs of fertility. Some of the indicators people rely on for fertility are changes in basal body temperature or changes in cervical fluid and the timing of their menstrual cycle. It is about 75% effective. Advantages include being free or cheap. It can include some costs, as some people will use ovulation kits, which cost money, but otherwise pretty cheap. Allows greater body awareness and virtually no side effects. Disadvantages are that this method requires a good deal of planning, communication with a partner, and effort. Additionally, it does not offer STD protection and is not an easy method to use if periods are irregular. A subset of this method is called lactational amenorrhea. This is for people who have recently given birth. The act of breastfeeding the infant prevents ovulation due to prolactin suppression of GnRH. This method only works with infants less than 6 months old, and feedings must occur every few hours whenever the infant is hungry for the full contraceptive effect. Advantages include that this can be used immediately after childbirth, it's economical as you're not paying for formula and you're getting free birth control, and it's a natural method. Disadvantages include that it is not as effective after 6 months, breastfeeding demands can be grueling, as breastfeeding must occur on demand, and it offers no STD protection. Next up are hormonal contraceptives. These include combined pills, the mini pill, vaginal ring, patch, and emergency contraception. Some of these methods use a hormone called estrogen, which causes particular side effects, some of which are positive and others that are negative. I've highlighted these in pink so they're easier to recognize. Combined oral contraceptives, or COCs as they're sometimes abbreviated, are pills containing estrogen and progestin that are taken daily for the most part. There are many formulations and dosages of these pills on 28, 84-day, and even longer cycles. These pills work through several mechanisms, including suppressing LH and FSH to stop ovulation, thickening cervical mucus, altering the endometrial lining to make it less receptive, and decreasing the motility of fallopian tubes. They are about 91% effective, but this rate is increased with correct and consistent use. Advantages include that they are easy to use, effective, provide a quick return to fertility after discontinuation, and some of the estrogen effects, as you can see in pink, include that they may lessen some menstrual symptoms, decrease acne, and lower risk of breast cancer. Disadvantages include that they offer no STD protection, the patient must remember to take the pill every day, they can be rendered less effective by certain medications, such as antibiotics, and some of the negative effects of estrogen, which I've listed in pink, which include nausea, headaches, breast tenderness, and increased risk of blood clots. This option is contraindicated in people with breast cancer, hypertension, cardiovascular disease, immediately postpartum, and people aged 35 or older who smoke, as well as people who suffer from migraines with aura. The mini pill is also an oral pill that contains only progestin and is taken daily at the same time each day. These pills thicken cervical mucus so that it is impenetrable by sperm. There is some research showing they may also suppress ovulation, but this is not consistent each cycle and is not the primary mechanism of contraception. They're about 95% effective, again, which can be greater with consistent use. Advantages include being easy to use, effective, and providing a quick return to fertility after discontinuation. Disadvantages include no STD protection, remembering to take them at the same time every day, which is even more important for the mini pill, and that some medications may get less effective, such as antibiotics. They can be used in patients with cardiovascular risk factors that cannot take combined contraceptives. A quick side note on another method of oral contraception. Emergency contraception is used after intercourse has taken place to prevent pregnancy if the primary birth control method has failed or one was not used. Emergency contraception in the U.S. consists of Plan B, Ella, and copper IUDs. We will talk about the copper IUD later when we talk about Larks. Plan B and Ella are both pills that can be taken up to 96 to 120 hours post-intercourse to prevent pregnancy, but are most efficacious the sooner they are taken after intercourse. They work by preventing ovulation and implantation as well as thinning the endometrial lining. Plan B is a high dose of progestin that prevents LH and FSH secretion through feedback inhibition, whereas Ella is a competitive antagonist and blocks progestin receptors, not allowing the endometrium to undergo the changes needed to prepare for the implantation of a pregnancy. These methods are 87 and 93% effective, respectively. Advantages include that they are safe, effective, available over the counter for Plan B, and private for a partner. Disadvantages are that they can require a prescription or clinic visit in the case of Ella and in the case of a copper IUD, and may cause side effects such as nausea, vomiting, abdominal pain, and headaches. The next two methods are not oral, but are also forms of hormonal birth control. They are very similar to combined oral contraceptives in terms of mechanism of action, the fact that they have a 3-week on, 1-week off cycle, and in terms of side effects. One of these methods is the patch. This is when a patch containing the hormones estrogen and progestin are placed on the skin to prevent pregnancy. People will use 1 patch per week for 3 weeks, then no patch for 1 week, and repeat. This method is 91% effective, and more so when used correctly, meaning it's placed at the same time each week. Advantages include that it's easy to use, you can see it in place, as well as the positive effects of estrogen noted in pink. Disadvantages include no STD protection, needing a clinic visit or a prescription, and the negative effects of estrogen. Also, the patch has higher levels of estrogen compared to the combined oral contraceptives, so there is a higher risk of blood clots. Lastly, for hormonal options, we will be talking about the vaginal ring. This is a flexible ring that is inserted into the vagina and contains progestin and estrogen that is absorbed locally. They use the same mechanism as combined oral contraceptives and the patch to prevent pregnancy. The ring is inserted and left in place for 3 weeks, then removed for 1 week, and replaced every 4 weeks. It is 91% effective and more effective when used correctly and consistently. Advantages include being easy to use, safe, fairly effective, and the positive effects of estrogen. Disadvantages include no STD protection, requiring visits to a clinic or getting a prescription, increased vaginal discharge, and the negative effects of estrogen. There's also a slightly increased risk of toxic shock syndrome, which you may have recalled learning about in the context of tampons being left in the vagina for too long. This risk can be decreased by ensuring hygienic insertion and removal of the rings. Next up are Lark methods. Lark stands for long-acting reversible contraceptives. These methods include implants, injections, and intrauterine devices, also referred to as IUDs. All of these devices, besides the copper IUD, release progestin and prevent pregnancy through a similar mechanism of action. An implant is a small plastic rod that is placed under the skin in the upper arm and left in for up to 3 years to prevent pregnancy. The implant releases progestin. Like the mini pill, it thickens cervical mucus and thins the lining of the endometrium. It is more than 99% effective. Advantages include being cost-effective, safe, maintenance-free for 3 years, easily removable, and private. Disadvantages include needing a clinic visit for implantation, offering no STD protection, irregular periods and bleeding, abdominal pain, and breast tenderness. A birth control shot is when a patient is injected with progestin every 12 weeks to prevent pregnancy. It is 91% effective, even more so when the shots are given on time. Advantages are that it is a safe, fairly low maintenance option as the shots are only needed 4 times a year. It is private, it can give lighter periods and less cramps. Disadvantages include no STD protection, needing to see a physician every 3 months, lowering bone density, and have side effects such as weight gain, abdominal discomfort, breast tenderness, and spotting or bleeding. Something really important to note for patients that want to become pregnant within the next few years is that it can take up to 2 years to regain fertility after discontinuation of this method. An IUD is a T-shaped device that is inserted into the uterus by a healthcare provider and kept in place by the cervix. There are 2 types of IUDs, hormonal and copper. First, we'll talk about hormonal IUDs. These contain progestin that is released locally to prevent pregnancy and can be effective up to 5 years depending on the brand and dose of progestin. Copper IUDs have a copper coil wrapped around the bottom of the device that acts as a spermicidal agent and prevents sperm from reaching and fertilizing an egg for up to 10 years. Both methods are more than 99% effective. For both of these, advantages include being very safe and effective, cost-effective, extremely low maintenance. They can be removed anytime and provide a quick return to fertility, and they last a long time. For copper IUDs, an additional advantage is that they can be used as a method of emergency contraception as well. Disadvantages include that both types include requiring an in-clinic visit for placement, which can be uncomfortable and painful. They offer no STD protection, and there is cramping and bleeding after placement. For progestin IUDs, patients can expect lighter periods or no periods at all, whereas copper IUD users can actually experience the opposite and have heavier periods than before IUD use. Rare side effects include expulsion and pelvic infections, but if those are going to occur, it's usually within a few weeks to months after placement. Last up for this video are the barrier methods. There's several methods of barrier contraception, including male and female condoms, cervical caps, diaphragms, and many more. So all of these methods have the same basic mechanism of action, which is physically blocking sperm from reaching and fertilizing an egg. They differ in where they are placed and act in the reproductive tract. Overall, they fall between 73 and 88% effective against pregnancy, and are even more effective when used exactly as instructed. Advantages include that there are few risks or side effects, they can be purchased over the counter, they're safe and placed by the patient, and they're one of the few methods that offers STD protection in the case of male or female condoms. Disadvantages include that they must be placed each time there is sexual contact. Some of the methods can be difficult to place correctly, there can be more irritation, and that they're not as effective as other methods at preventing pregnancy. So that was a lot of information. Please feel free to go back over these slides as you need and check out some of the resources in the folder to learn more about each method. I wanted to sort of consolidate what we talked about by pulling out some key themes. One theme is that methods with less maintenance and less human error lead to greater effectiveness. Another is that almost none of these methods protect against STDs besides condoms, but this method alone is not as effective at pregnancy prevention. So these methods can and should be used in conjunction with a more effective method in patients that desire both effective pregnancy and STD prevention. Lastly, if you're ever unsure if a medical condition, medication, or family history is compatible with a certain type of birth control for your patient, chances are it will be included in the contraception app. So be sure to check that out before making recommendations, especially in patients who have complicated histories. Okay, so I wanted to give you the opportunity to practice some of the things we learned with the case. So we have our case, we have Ashley, a 25-year-old G0P0. You can read the case, pause now, and think about the question. Okay, I'm going to move on to the next slide. So let's consider what we know about Ashley. She was previously on a non-hormonal, low-maintenance IUD that she tolerated well, and she is in a long-term relationship. Let's now consider the major categories of contraception. She could be put on a hormonal contraceptive, but not one containing estrogen due to her history of a DVT or blood clot. This would rule out combined oral contraceptives, the patch, and the vaginal ring, but she could still use the mini pill as that does not contain estrogen. Because she wants to conceive in a few years, sterilization is ruled out as well. As for Lark Methods, she could try the hormonal IUD or get another copper IUD since she tolerated this method well in the past. She could also try the implant. As for the birth control shot, this would not be a great option for her because she is specifically concerned about weight gain and because it can take months to return to normal fertility with this method, so there would be no point in her starting this method now if she wants to get pregnant in 1 to 2 years. As for lifestyle and barrier methods, Ashley has indicated that an effective birth control method is important to her, and these methods are significantly less effective than her previous method. In addition, although she's in a long-term relationship, she should still be counseled on STD protection. So there's no right answer here, but we have eliminated some options that would not work with Ashley's goals and her history. So now we can counsel based on what will work best for her out of the remaining options, as this is a shared decision between Ashley and you as the physician. Thank you so much for listening. Please check out the resource folder for more information. Next, we'll be discussing sterilization, which is a permanent method of birth control.